Today I want to talk about where we think healthcare will be in 10 years in Texas. And to me, the word that came to mind is booming. Booming because this is already an industry that's leading in Texas. It's leading in job growth. Many communities, their number one employer is in the healthcare industry. I think you're only going to see more in that, and the job market's just going to grow in healthcare. Sounds awesome. How are we going to do that? How's that going to happen? Here's the trick. We're going to get sicker and sadder, less productive, and we're going to cost more. Sound awesome? It's really not what you usually think about when you say, hey, Texas' economy is booming, and we all get really, really excited about that, right? We feel proud. When I tell you that healthcare is going to boom for those reasons, do you feel proud? So one of the things I like to do is try to simplify healthcare. It's in my DNA as a primary care physician and a small town kid, is to try to simplify really complex things, and healthcare is really complex. So when you think about this growth and all this revenue that's going into it, and we're going to get to 20% of the GDP, who's winning if it feels bad? And I think you need to understand a little bit of that to think about how we might solution this. Number one is you have the hospitals winning. More and more consolidation, more and more revenue goes to them. And here's what's interesting. In most communities, you have these large hospital systems that are tax exempt. So not only are they driving revenue and driving up costs, but they're tax exempt. Something to think about. Secondly, you have big pharma. The 5 families of big pharma, it's like the mafia. They make more and more drugs at higher and higher prices. It's the most profitable industry in the world. And guess what? As you get sicker, you need more drugs, and they're making them at a record clip at a rising price. Who else is winning? Well, the insurance companies. The big 5 insurance companies in America, the BUCAs, make up 85% of the market cap of the healthcare industry. 5 insurance companies, 85% of the entire market cap of the U.S. That's staggering. Look at the Fortune's 20, top 20. You'll see all of them there. Healthcare is booming, but who's losing? You see, we all are. We all are. You may have heard that physicians are at the highest level of burnout in history. We commit suicide twice the rate of the going public. Those are the people that are taking care of the patients. If we want a healthy citizenship, we probably need some healthy physicians. Patients themselves, super complex, super hard to understand the healthcare system. The number one reason for bankruptcy as an individual is what? Medical debt. It's hard. Half the people have nothing in their savings, yet we give them all $1,000 deductibles. Employers are losing. What's the thing that they complain about the most these days? They're going crazy. Premiums have doubled in the last 10 years in Texas. And guess what? For us to have this booming healthcare industry for the next 10 years, they're going to double again. So what does that mean? What are the trade-offs that happen when you see this booming happening? You have these winners and losers. What are the trade-offs? Let's talk about trade-offs for just a second. Let's start at the government level. State of Texas, about 1/3 of the budget is for healthcare. If that keeps going up in a fixed pie, where do you trade off? It's a choice. Where do you trade off? Social services, mental health, education, transportation, infrastructure, all of those have to be sacrificed if healthcare goes up. Or we can raise more taxes and everyone likes that too. Almost a laugh. Let's go down to the employers. As the employers, these premiums keep going up. What's happening? You got wage stagnation. Wages have been almost the same as inflation for the last 20 years. It's going to keep happening. And what does that mean? The employers can't have R&D, can't add new services. And then what about at the family level? We all have this fixed amount that we bring home every year. And it was one thing when healthcare was like 6% of our costs, but now as it's getting to like, depending on the wages you bring in, especially if you're below the average of $55,000, it's starting to creep into 15%, 20%, 25% of your take-home pay is somehow going to healthcare. What do you trade off at home? Food, clothes, transportation. These are real problems. And as healthcare continues to boom, they will become exaggerated. So what do we do? What do we do? Let me tell you, the status quo is going to keep being the status quo. It's going to take remarkable transformation for this booming to be anything other than what I just described to you. The people with the dollars and the stakeholders that are winning, it's going to be really hard to change. Something unlike you've only seen a few times in American history, in my opinion. So how do we get a new narrative? If we had a new narrative, it would look something like this. We would think all of these resources that the healthcare industry is taking today, we'd give them the right amount, and then we'd give it back to communities, businesses, people. We'd have all these new resources that we could use to make our communities thrive. And healthcare would just take just enough. So what would that look like? Let's talk about what that would look like. I'll give you 4 things. Number 1, we'd upend 180 degrees the healthcare system, and you would start with primary care instead of where we have right now is a very reactive sick care system. We would move upstream to primary care. Did you know, this is a fact that's been around for a long time, if you have a primary care physician, you've been shown to live longer, cost less, and have more days at work. Why wouldn't we be prescribing everybody that? Yet we only spend 5% of our dollars on that. So you start there, number 1, because those relationships are long-term and they matter. We make decisions, we make changes based off of relationships. Healthcare today is transactional and reactive. You got to make it proactive and relational. And then you got to connect it. You got to connect primary care into the social fabric of communities, into all the not-for-profits, into all the community resources. We have to understand that we're interconnected, and healthcare is not a silo. It's not something we just do from 9 to 10. It's who we are. It's who, as we live our lives. It's who we are. How do you connect that into the rest of the community? And then the fun thing to say right now is, oh, well, there's AI and tech, and that's all going to change the world. And I actually think it will. But it's going to be because it supports the relationship, not replaces the relationship. So how are we going to do this? How are we going to do this? How do we create the new narrative? All right, where can we go back in our history and think of how we can get a 180-degree shift? There's one thing that brought to mind was when JFK in 1964 said, hey, we want to go to the moon in 10 years. We had no clue how to do that. We didn't have the material sciences, but we decided collectively as a nation with the courage of the leaders that we were going to put our resources around it and did that. And we did it, and we did it within that time. You know, that was part of the greatest generation that did all those things for us. You know, and quite frankly, I don't think the baby boomers of today or even my generation, X, is going to do it either. I'm really counting on the millennials. They're going to be the largest percentage of the workforce over the next 10 years. They care differently. They've made an impact on every single industry that they've touched, and I think they're going to do it again. But folks, this is going to absolutely have to be something that's completely transformational. And it feels like we might be one of those places in history right now where it could happen in the last decade. We've needed it to happen in the last 3 decades, but this might be the decade. And if you go back to like the American Revolution or the Civil Rights Movement, you know, those people didn't know they were a part of history at that moment. They didn't know that they were about to bring in something new and totally different at that time. But what they did know is it really felt like things were falling apart. They all had that sense that things are falling apart. If you were in healthcare today and the way I described it, you get that sense it could be falling apart. But with that, you can bear something new. And I think the next generation can bear that. Specifically, the Texas millennials can bear that. Because as we say here, as Texas goes, so goes America.